This video will discuss various aspects of antidepressants. Included will be an introduction to the disorders and their etiologies in regard to those utilizing antidepressants. It will also explore how these drugs work, the various types, and more in-depth information regarding what is included. Lastly, side effects, efficacy, dosage, and a counselor's role in usage of antidepressants will be included.
Imagine, it's many years in the future and you are working as a counselor. What if Eeyore, Monk, Piglet, Lieutenant Dan, and Demi Lovato all came into your office? What do they all have in common? Could you figure it out? If not, well, here's the answer. Each of these individuals with their corresponding diagnoses could all be treated using antidepressants.
Many people use antidepressants, as much as 11% of the population. It is necessary to treat various disorders, which will be described in this video. It can be used to alleviate reactive and psychosocial circumstances. It is most commonly prescribed to treat physical depression. The underlying causes of this depression may be for various purposes, such as isolation from others, attitude, fear, feelings of unworthiness, and dealing with faulty beliefs. For those taking it, approximately 2/3 find it successful.
The diagnostic criteria for major depression can be remembered using the acronym SIG-E-CAPS, with each letter representing a change in a symptom. So this includes depression, along with sleep, interest, guilt, energy, concentration, appetite or weight, psychomotor skills, and suicidality, which together equal a loss of function. One of the main supported theories for explaining the etiology of major depression is the monoamine hypothesis. This hypothesis states that in the brain, there is a decreased amount or function of the neurotransmitters serotonin and norepinephrine, which lead to the symptoms of depression. Antidepressants are also very commonly used to treat various anxiety disorders. The most commonly used are in generalized anxiety disorder, panic disorder, and social anxiety disorder. The diagnostic criteria for generalized anxiety disorder includes constant excessive anxiety or worry, a difficulty to control this worrying, and other symptoms related to restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbances. Panic disorder, another type of anxiety disorder, is characterized by recurrent unexpected panic attacks, which is a sudden feeling of intense fear or intense discomfort associated with other physiological symptoms, including palpitations, sweating, trembling, sensations of shortness of breath, feelings of choking, chest pain or discomfort, nausea, dizzy feeling, chills, derealization, fear of losing control, and fear of dying. Associated with these attacks is a persistent feeling of worry about when the next time you may have an attack is, and a change in behavior related to the attack, such as avoiding situations where you may have these panic attacks. A third type of anxiety disorder that can be treated using antidepressants is social anxiety disorder or social phobia. This disorder is characterized by a marked fear or anxiety about social situations in which the individual is fearful of negative evaluation by others or being scrutinized by others. Social situations almost always provoke fear or anxiety, and as a result, social situations are typically avoided or endured, but only with an intense fear or anxiety. There are many proposed causes and theories of anxiety and anxiety disorders. One behavioral theory is through conditioning, and this is where the subjectively experienced anxiety that a person feels over time becomes a conditioned response to the physical signs of anxiety, such as rapid heart rate and rapid breathing. Another cause is the effects of stress, where people who have higher reported levels of stress are more likely to develop anxiety and a resulting anxiety disorder. A third proposed cause is genetics, where an individual with a first-degree relative who has an anxiety disorder is more likely to develop an anxiety disorder themselves. Antidepressants are also a common treatment in obsessive compulsive disorder. Obsessive compulsive disorder is characterized by two main diagnostic criteria of obsessions and compulsions. Obsessions are recurrent and persistent thoughts experienced by the individual, and the individual attempts to ignore or suppress these recurrent and persistent thoughts. Compulsions, on the other hand, are the repetitive behaviors or mental acts done in response to the obsessions, and they are typically done to reduce or prevent anxiety. In addition, these obsessions and compulsions are typically very time-consuming and cause significant distress to the individual. One cause of OCD is that individuals with neurological disorders or brain insults due to trauma or infection are more likely to develop OCD. Also, abnormalities in the frontal lobes, basal ganglia, and cingulus areas of the brain have been found in individuals who have been diagnosed with OCD. Genetics are also a strong cause in the development of OCD, with a 70% concordance rates for OCD among monozygotic twins, and also an individual with a first-degree relative has a 25% chance of having OCD as well. A psychodynamic theoretical explanation for OCD states that obsessions and compulsions develop in three phases. There's an internally perceived dangerous impulse, the threat of what would occur if this impulse were acted upon, and then the individual uses defenses to avert this threat, such as repression, isolation, and undoing. Post-traumatic stress disorder, or PTSD, can also be treated using antidepressants. The diagnostic criteria for PTSD first includes an individual experiencing exposure to an actual or threatened death, serious injury, or sexual violence in various ways, intrusion symptoms associated with the traumatic event, such as recurrent memories or dreams, avoidance of stimuli associated with a traumatic event, negative alterations in cognitions and mood associated with the traumatic event, and also alterations in arousal and reactivity associated with the event. And these symptoms have to have a duration of greater than 1 month to be considered PTSD. The etiological explanations for PTSD are mainly biological theories. One is that the amygdala, which is part of the limbic system which controls emotional memory, seems to be overactive in individuals with PTSD. Another theory is that sustained hyperarousal in the brain, which is experienced by people who are experiencing trauma, seems to elevate cortisol levels, or the stress hormone in the brain, which therefore alters the HPA axis, or the hypothalamic pituitary adrenal axis. These chronically high levels of cortisol may damage the hippocampus, which is responsible for cognitive memory, which may lead to the development of PTSD. Antidepressants can also be used in two types of eating disorders, bulimia and anorexia. Bulimia consists of recurrent episodes of binge eating, which is eating in a short period of time, an amount of food that is larger than considered normal, and a sense of lack of control over eating during this time period. The individual also engages in compensatory behaviors to prevent weight gain, such as vomiting, laxatives, diuretics, fasting, or excessive exercise. Anorexia consists of an individual with a significantly low body weight due to the restriction of energy intake, less than what is required for that individual's body. Also, the individual has an intense fear of gaining weight or becoming fat, while also having a disturbance in the way in which that individual views their body weight or shape. Not much is known about the cause of bulimia, but one theory is related to the family atmosphere. Families in which a member of bulimia appear enmeshed but also have disengaged qualities. These qualities include high expectations, disorganizations, lack of ability to solve problems, and the possible presence of domestic violence, abuse, or neglect. One etiological explanation of anorexia involves the psychological features of the individual, including perfectionism, dread of losing control, and the distorted perception of their own bodies. There is also a strong genetic or heritability component associated with anorexia as well.
Other disorders that may be included, yet are less likely to add antidepressants to treatment, include bipolar depression, substance abuse, and premenstrual disorders. The overall goal for antidepressants is to restore normal biological functioning, particularly within the nerve cells in the brain, to establish equilibrium. It attempts to block the reuptake of serotonin into presynaptic cells in order for the neurotransmitter to stay in the synaptic cleft for a longer period of time. Serotonin is the neurochemical most utilized in mood regulation. Other neurotransmitters include dopamine, norepinephrine, and GABA. The process for antidepressants begins when the electrical and chemical impulses send the neurotransmitter, let's say serotonin in this example, through the axon and is deposited into presynaptic vessels. Once this has occurred, the serotonin moves from vessels into the synaptic cleft. It then moves into synaptic receptors. Once there, the neurotransmitter will impact and influence receptors by either activating or inhibiting. After its job is done, the neurotransmitter will reuptake in order to begin this process again. There are various types of antidepressants, including cyclics, selective serotonin reuptake inhibitors, serotonin and norepinephrine reuptake inhibitors, norepinephrine reuptake inhibitors, monoamine oxidase inhibitors, atypical antidepressants, and hybrids. Cyclics, also known as tricyclics, are part of the oldest group of antidepressants. Members of this group include tofranil and anafranil. A few of these cyclics have also been used for other purposes such as antipsychotics and for chronic pain. They are more popular for treatment of OCD and depression. Many of these agents are dual action as they block the reuptake of both serotonin and norepinephrine. The difficulty in cyclics are within the side effects. They are sedating and have been known to enhance the effects of sedating alcohol and can be dangerous in overdose. There are other side effects too, such as dry mouth, constipation, weight gain, and a decrease in libido. SSRIs are popular today as they are the most prescribed class of antidepressants. They work by blocking the reuptake of serotonin. This group includes medications such as Prozac, Zoloft, Paxil, Celexa, and Lexapro. When compared to cyclics, they are better tolerated, safer in overdose, and can be taken once a day per dose. However, there is not enough data to support the efficacy between the two. SSRIs too have side effects. This includes increased anxiety, sedation, insomnia, sexual dysfunction, and weight gain. The best way to discontinue SSRIs is when it is done gradually. If done so abruptly, it has been shown to cause withdrawal syndrome. This is where clients have reported electric shock sensations in their hands and feet, as well as brain zaps in the head. However, these have not been found to be dangerous. SNRIs are considered dual action as they block the reuptake of both serotonin and norepinephrine. The most common drug in this category is Effexor, as it has been called the Prozac with a punch, due to its effect on norepinephrine. Other SNRIs include Cymbalta and Pristiq. The latter has been shown to assist in management of chronic pain as well. One of the side effects includes high blood pressure, and clients are recommended to monitor this area. The other side effects are similar to those mentioned previously when discussing SSRIs. The main NRI drug is Strattera. Although this is labeled as an antidepressant, as it blocks the reuptake of norepinephrine, it is not FDA approved to treat depression. It is actually sold to treat ADHD due to its ability to give energy boosts and decrease distractibility. MAOIs have been around for over 60 years, but are rarely used today, primarily due to their serious drug and food interactions. Monoamine oxidase is an enzyme in the central nervous system used to metabolize neurotransmitters at a presynaptic nerve ending. MAOIs inhibit the actions of that enzyme. Popular drugs within this group include Parnate and Nardil. There's also patch for MSAM for the drug to be absorbed through the skin in order to reduce side effects. As stated previously, this drug has high incidence of interactions, both drug to drug as well as food to drug. It is especially important to be aware of combining MAOIs with over-the-counter drugs. MAOIs should also never be combined with SSRIs due to developing serotonin syndrome, which can produce fever, sweating, twitching, high blood pressure, coma, and perhaps death. The food and drug interactions are mainly due to the amino acid tyramine. This acid is important for maintaining blood pressure. If these two interact, it can cause a hypertensive crisis when arterial blood pressure rises as well, as symptoms such as dizziness, sweating, and tremors may occur. Some food is not to be mixed with MAOIs due to the tyramine. This includes alcohol, aged cheeses, some meats, fruits, vegetables, and more. Atypicals don't fit into one antidepressant group or family. The most well-known atypical antidepressant is Wellbutrin. This targets dopamine and norepinephrine cells and can be considered a reuptake inhibitor of these neurotransmitters, making it a DNRI. The side effects are primarily anxiety and insomnia, with a possible risk of seizures at doses more than 400 milligrams per day. Other forms of atypicals are used to avoid side effects with fewer doses per day. Remeron works on norepinephrine and serotonin, but due to the high number of liver failures, it is not prescribed in other countries and it is avoided in the US. Hybrid antidepressants are a combination of action mechanisms to create a new drug. For example, Vybrid combines SSRI like Prozac action with the anti-anxiety drug Buspar to target the serotonin receptor 5-HT1A. It inhibits serotonin reuptake and acts as a partial antagonist for the 5-HT1A receptor. It does have side effects with some minor weight gain and few sexual side effects. Brintalex has a similar path and side effects as Vybrid, with the difference being varied receptor binding. As you can see, there are many different types, classes, doses, and purposes for the various antidepressants. The question that needs to be asked is which one to use. Each client will have differing needs and reactions, creating a trial and error component that will target the goal as well as produce the least amount of side effects. There are many different ways to choose an antidepressant drug, but here are a few ideas. How does the depression present? What other symptoms is the client reporting? Anxiety? Insomnia? Due to the side effects of the drug, it is important to consider signs and symptoms. For example, someone who also presents with insomnia, in addition to his or her depression, may want to avoid Prozac due to its energizing effects. Another way to examine the categories is based on the personal and family history. If the client has had an antidepressant in the past, looking at what has worked is a good start. This can also be implemented into family attempts at using medication. Drug characteristics is another way to address this choice. Similar to depression presentation, it is necessary to find out what accompanies the depression and perhaps counter the insomnia. The client needs to have a more sedating antidepressant to fix this area. Reasonable expectations also plays a role in decision making, as clients need to know what to expect in the efficacy, timetable, as well as with side effects. This also wraps into an initial response. If a client experiences a negative side effect, they may engage in a non-compliance, and it is necessary to avoid this to encourage clients to proceed through this trial and keep taking the medication. Lastly is the general option of having client choose. The person may know what is best for him or her and know what side effects they are capable of dealing with. If a client feels empowered to take the medication and have support, they are more likely to keep successful regimen and engage in taking the antidepressants. As mentioned when discussing the different types of antidepressants, there are many different side effects to be acknowledged. There are no perfect drugs, and side effects are bound to occur. If the effects are discussed up front, the client can be aware and is prepared to stick out the medication through the short-lived effects until the body adapts. Assisting the client to use the effects in a positive manner will help as well. For example, if the antidepressant side effect is sedating, perhaps taking it before bedtime will be helpful. One of the most common side effects is in sexual dysfunction, and this one most people struggle to tolerate. As much as 50% of those who use antidepressants experience these difficulties. There are a few steps that can be taken to address this problem. First, make sure the medical conditions are ruled out. Even if this is not the problem, make sure the client continues the medication and avoids an abrupt stop, as the side effect cycle will begin again if the drug is restarted. Another way to deal with this issue is to reduce the dose. It can reduce the side effects while continuing to relieve depression. Some clients could additionally use medications such as Viagra. This will help offset the difficulties, or they can use other antidepressants such as Wellbutrin to augment. There are many ways to manage side effects, and working with the client to establish the best route will be most helpful. There are many difficulties that go along with antidepressants, not including side effects. One of these areas is when the brain tries to compensate when medication has been taken. Its goal is to return to what has been established as normal functioning or equilibrium. Another issue is in diminished returns, as today there are more than 40% of clients using this group of drugs and they have become treatment resistant. As much as 80% of those who remain on antidepressants experience reoccurrence. Another difficult area is with faulty expectations. Sometimes those who take medication feel it will fill a happiness void and suddenly make it better. Some believe it will change their behaviors. As much as we would like this to be true, there are no magic pills with special powers to change us. Playing a role into these perceptions may be the media. This includes TV, internet ads, and other forms of various media, and these create false hope or preconceptions about what a drug can do. It manipulates viewers into thinking the medication has a method of instant gratification and they play a role into one's vulnerabilities. Other difficulties include oppositional tolerance, tardive dysphoria, and discontinuation syndrome. The question then arises, do they really work? Based on the data, the answer is yes, in all but the mildest cases of depression. Over the courses of numerous studies, they often come to the same conclusion of antidepressant success. It is necessary to be aware of bias, co-occurring disorders, methodology, and more in regards to these findings, but even so, they point in a positive direction, with approximately 25% of those treated with one antidepressant having a full remission of symptoms. It has also been found that 73% of those improving with antidepressants may be attributed to the placebo effect. Antidepressants are not in place for long-term use. With more individuals prescribed these drugs, it is necessary to act in the best interest of the client. The medication can be seen as successful when the person feels more energetic and motivated to accomplish various parts of life. Even with these improvements, there are no magic pills with great powers. Antidepressants are included in this statement. It is more important to know the benefits and limitations in regards to this form of treatment, and therefore, looking at other methods may be helpful as well. In this table, you can see the dosage range chart for antidepressants. These dosages are a guideline and they depend on the source as well as varying personal factors such as age. Included in this table is the brand name, generic name, class, and recommended daily dose based on these preceding factors.
Even though we as counselors will not be able to directly prescribe our clients antidepressants, we still have a very important role in their treatment. If a client is presenting with more biological causes and symptoms of their depression, such as changes in sleep or appetite, it will be important to refer them to a psychiatrist or another prescriber to receive antidepressants as a form of their treatment. This is because antidepressants target these biological deficits and will be more effective and are recommended for this type of depression. Therefore, if a client is presenting with a more reactive type depression, such as that indicated for psychosocial stresses that may happen in the environment, it is not recommended that this type of client receive antidepressant medications because they will not help with this type of symptom relief. Another important consideration that counselors have in their role for referring for antidepressant medication is that antidepressants are recommended and more effective in moderate to severe forms of depression. Therefore, if a client is presenting with these more severe forms of depression, it is important to refer them for antidepressant medication. Another role counselors have is in the form of advocacy. This can be the counselor directly advocating for the client to their prescriber or psychiatrist, or helping the client to advocate for themselves. The advocacy can take the form of helping the client to realize that the antidepressant medication will take time to work and that they are feeling the symptom relief after the amount of time has passed, and making sure that the client is on the most effective and right antidepressant to help manage their symptoms. Another form is through side effect management to make sure that the client is able to manage the side effects associated with the antidepressant medication they are on and help them to advocate to change or switch to a different medication if the side effects are too much for them to handle. Another role for counselors is understanding the importance of combining therapy with antidepressant medication treatment. The therapy should focus on building on client strengths and targeting the faulty thinking and faulty behavior that the client experiences as a part of their depression. Many treatment models, such as cognitive behavioral, dialectical behavioral, motivational interviewing techniques, and mindfulness, are all effective in helping to treat depression. So overall, even though we will not be able to directly prescribe our clients antidepressant medications, counselors still have a very important role in this type of treatment.
Thank you for watching this video, and if you have any questions, please consult the following references.